You're here because you find it almost impossible to stop smoking. You know that smoking's bad for you. You know that it can cause all manner of lung diseases. And knowing this, you've tried to stop. But nothing you've tried has worked as a permanent solution. So that's why you're here. You sincerely want to stop. Now, for us to be able to help you, we're going to need your full attention. So could we ask you to clear your mind of all outside distractions, and then when you're ready, and wait until you are ready, then push the button to proceed. Thank you. I want to show you a typical patient. I can't give you the patient's name, of course, for privacy reasons. The patient is a smoker. He smoked for a considerable time, and he's tried to give it up for good, but failed. He has by this stage become aware of the danger to his health posed by his smoking. He's aware of the danger to his lungs of emphysema and lung cancer. He's less aware of the far more immediate danger of heart attack. If this is the risk of heart attack for a patient of this age and physical condition, because he smokes, his risk of having a heart attack more than doubles. Some figures suggest the risk may be 5 times as high. With every cigarette, he moves one step closer to the risk of a heart attack. Every cigarette he smokes pushes the process along. This is the patient's partner or spouse. His partner is really worried. There seems to be nothing that can be done to help him. Information has failed. All means of persuasion have failed. Anti-smoking aids have failed. All efforts have failed. Ahead, the partner sees real potential disaster. These are his loved ones. There is nothing he wouldn't do for them. But with this danger to his health and his life, there is nothing they can do for him. Every single cigarette he smokes increases the risk of heart attack. We don't know how it might happen. For some, it happens with the exertion of walking upstairs. For others, it is over the handle of a lawnmower. It can happen when you least expect it.
Help somebody!
Usually, the patient doesn't pay much attention to warning signs. There's too much noise. There are too many demands, too many distractions, too many expectations upon him. And anyway, the symptoms are non-specific. She simply feels a bit tired. Anyone can feel tired. Fatigued. She just doesn't feel like herself. Maybe a bit short of breath. Has to stop sometimes, perhaps. It can happen at the most unexpected moment. A woman in the parking lot is having trouble unloading a shopping trolley.
Oh, thank you. Are you okay?
You alright?
Is he okay? Are you alright?
Give me the phone.
Babe, what's happened?
Help.
I've called them. They're coming.
The ambulance should be here in a
We're
minute.
getting help.
Oh, they've got to get here soon.
It'll be all right. We're getting help.
Ambulance. Can you tell me what's happened?
It's going to be all right, or?
He just collapsed.
Has this happened before?
Well, none of us know him. I was just getting some shopping out of my car and he just collapsed and he's sort of been in and out of it.
5. 1, 2, 3,
It
4,
happened so
5.
fast that we didn't
We
know
need
what
to get him
to
up to
do.
hospital, so we need to go and get the trolley.
Right.
Any heart attack is highly dangerous. As you've seen, smoking more than doubles the risk of heart attack and stroke. With every cigarette, nicotine, tar and other noxious compounds pass down the windpipe and into the lungs, where they're rapidly absorbed into the body. The nicotine speeds up the body's systems as the particles travel rapidly to the brain and the heart. Plaque builds up under the lining of the blood vessels to both the heart and the brain. Watch what happens to the lining. As the plaque builds and builds, the lining weakens and stretches to breaking point. The heart pumps faster. The plaque eats into the walls of the arteries and neurons fire more rapidly. At a certain point, and we do not know which cigarette that may be, the body crosses over the point of no return. Somewhere in the blood vessel, the lining ruptures and a blood clot forms. If the clot blocks the blood vessel, the heart will be immediately starved of oxygen and nutrients. The muscles in the heart begin to spasm. You experience a heavy weight sitting on your chest. There may be a feeling of doom and shortage of breath. Your heart is under attack, which means that you are under attack. Your electrical system, already pushed to capacity, may short circuit and go haywire, leading to a body in chaos. This fast and chaotic rhythm is called ventricular fibrillation. If it cannot be stopped, if there is a delay, if you're not close to help, if expert medical assistance can't get to you promptly, you will die. And medical assistance itself is no guarantee. If the damage to your heart is too severe, there may be nothing the doctors can do. We really don't know if this patient is going to survive. Whatever happens, his loved ones will have a really terrible time waiting to find out what will happen. With a heart attack, he has 1 chance in 5 of not making it to hospital alive. The damage to the heart may be too great. Hopefully, though, he may be one of the lucky ones. If they can get him to the hospital quickly enough, if the hospital can respond quickly enough, if they can find the blocked artery and open it, then perhaps they can save him. They'll give him medication to thin the blood, keep him in hospital and monitor his heart, watch to make sure that there's no second heart attack, and they'll keep him there until they're sure that he's safe to go home. But in fact, there is a high risk of serious damage to the heart. This damage may be permanent and irreversible. His future may be significantly restricted. And the most significant risk is that he will not pull through at all, and his loved ones will have to make it on their own. None of this is necessarily inevitable. The patient is a smoker. He smoked for a considerable period of time. He's tried to stop, but failed. Damage to his heart is the most immediate danger, with a strong possibility of heart attack. There is a way to prevent this story. If he stops. If he stops, his risk of heart attack begins to retreat almost immediately. If he stops, the imminent danger of heart attack slowly and steadily falls away. But we do not know what this patient will do.